Some people feel that they shouldn't ask certain questions because they feel they are stupid. And actually, those questions are really valued and very valuable in terms of contributing to them understanding what's going on with their life, and actually could inform quite a lot of other issues that needs to be addressed in them feeling comfortable in living with the HIV. It is really, really important for us to give space and time.
I think the ability of peer support workers to support patients in asking for their needs to be met and talking about more openly about what's going on for them has a great benefit in the consultation. For us to be able to say, no, you can talk to the doctor, the nurse about anything. They've seen it all, they've heard it all. Just go in and be honest and we'll deal with it. When I'm supporting somebody around how they're dealing with HIV is to get them to think about, if you've only got one appointment every 6 months, what do you need to get from that? And so what do you prepare in terms of getting it done?
Because I feel any patient has the right to find out more about how to live their life, not just about the medical side of things and did you take your medication, do you do this, do you do that? It needs to be broader. They need to see the bigger picture. They need to know that there is life after diagnosis, at whatever age you're at, or whatever stage you're at.
Some of the best consultations that I have is when I've seen someone that they've spoken to someone like in peer support and they've prioritized, so I'm having difficulty sleeping, I'm really anxious, and they've come with that list. They come to me and then we can work together to work through that list and then go through any questions that they have. It's a two-way thing, so also it's for healthcare professionals to create a space that you feel safe, that you don't feel anxious, you don't feel fearful to come and say what's on your mind, and I think that's really important. So it's about working together and building that relationship.
For us as healthcare professionals as well, we need to try and drive some of these processes because it's important to also find out from your patient, it's like, since the last time I saw you, what has actually happened? Have you had to see a GP for any other reason? So it's that openness as well from the healthcare professional that is very vital to facilitate some of those processes as well. It is important that we make it very clear to our people living with HIV that we have other healthcare professionals that are going to be involved in their care. That includes general practitioners.
So many people feel that if I come to a consultation and I've got all these questions and points, actually I'm going to annoy my consultant, I'm going to annoy the nurse. But actually we really welcome that because then you're focusing on the right things for that person in front of you. And that is the key thing in a consultation. It's not for the doctor, it's for you. And so it's important that we know what you need so that we can give the best support that we can.
Peer support workers and mentors are a key part of the wider healthcare team.
Speaking to someone you can relate to can help you to narrow down what you want to focus on to live well with HIV.
And if you're part of the wider healthcare team, recommend peer support.
And always ask about their overall health and well-being.